हिक्का प्रतिषेधं व्याख्यास्यामः यथोवाचबन्धुमन्त्रिः विलाहि गुरु विष्टम्भि रूक्ष अभिष्यन्ति भोजनैः शीतपान आसन स्थान रजो धूम अनिल अनलैः व्यायाम कर्म भार ऊर्ध्व वेग आघात अपदर्पणैः आमदोष अभिघात स्त्री क्षय दोष प्रपीडनैः विषमशन अध्यशनैः तथा समशनैरपि Hikka Shwasascha Kasascha Nृणां Sampajayate. Hikka, Shwasa and Kasa. These are three interrelated diseases according to Sushruta, and they do occur due to the variations in the food, like the quality of the food, like those spicy food, those which are heavy to digest and which may produce the constipation, dry fruits like junk food, or abhishanti which produces more of secretions, or due to consumption of cold water, or sitting for a long duration, or maybe due to exposure to the dust or smoke, or maybe the breeze, or excess of exercise, or carrying heavy weight, walking a long distance, or even due to langhana, that's fasting, or due to accumulation of the amadosha in the body, or due to trauma, or sexual indulgence, or due to vitiation of the doshas, vishamashana, adhyashana, samashanaihi. Even during after the normal food also, the hikka shwasakasa can occur. The definition of hikka is muhurmuhu vayu ude disasvano yakutli hadrani mukhadiva akshpannam sabhoshavan ashu hinasya asun yataha tadastu hikka iti bhishakbhi uchyate. A situation where there would be a reverse movement of the vata, that's the air containing in the abdomen, and the person will be feeling as if the intra-abdominal contents like the liver and the spleen are coming out through the mouth. That kind of a feeling is there with a loud sound. That kind of an activity is called as hikka, or now in the English word also it's called as hiccup. That word hiccup comes in because of the similarity in the sound of hic, that's it. Annajam, Yamadam, Shudram, Gambhiram, Hatim Tada, Vayu, Kafen, Anugadha, Pancha Hikka, Hakaroti. According to Sushruta, there are 5 varieties of the hikka which could be due to the food, or it could be due to the multiple causes. MLI is multiple causes. Shudra hikka, Gambhira hikka, and Maha hikka. These are the different types of the hikkas. As I told you earlier, the hiccup word, which is derives from the sound of the bend, that the other alternative is a hiccup. Either it's a hiccup or hiccup. Both of them are correct from the English literature point of view. The definition of hiccups are a reflex that occurs when a diaphragm contracts suddenly, causing the chest and abdomen muscles to shake, and this is followed by the glottis closing, which creates a hic sound when the air is expelled from the lungs. Now, this reflex, what are all the contents in the, or what are all the structures involved in the reflex. The whole mechanism of reflex was explained by Bailey in 1943, and even now the same definition or same physiological components are studied to be, or accepted to be the true factor of that hiccup reflex. So hiccup is a reflex activity which is produced by the contraction of the diaphragm, and that contraction of the diaphragm would be triggered by the phrenic and vagus nerves and sympathetic chain from the T6 and T12. So the whole reflex activity starts from the phrenic nerve or vagus nerve irritation, or some stimulation of these as such, and then it reaches to a hiccup center. Now hiccup center is again presented or supposed to be believed between C3 and C5 in the local cervical segment, and it's a hypothetical one, and it's not really identified anatomically, but it is believed to be at that level. So the level is below the cortex or below the brain, the hypothalamus. So it is considered to be a high spinal reflex, and it connects to respiratory center, phrenic nerve nuclei, medullary reticular formation, and hypothalamus. There will be from that reflex center, there will be connection over there which are maybe depressive. Then efferent nerves are again phrenic nerve, the same phrenic nerve, particularly C3, C5 segment, and the scalenus muscles and external intercostal muscles, glottis would be taking part in that, and with the stimulus. The autonomic process would be inhibiting, decreasing the esophageal contraction tone and lower esophageal sphincter tone. These are the changes which occur during the action of hiccups. The same, it's mainly the environment of the center and the cervical segment is the major this hiccup center. It also has a inhibitory control from the higher centers like hypothalamus, temporal lobe and reticular activating system. In majority of the situations, this would be inhibitory, so this center would be inhibited continuously. Occasionally, due to some variations there, even it could be stimulated. Now, these signs, plus and minus signs, majority of the situations it is minus, but at times it could be stimulated. When this center is stimulated by this efferent activity of upper airway, esophagus, diaphragm and so on, and the same reflex mechanism is created through the efferent nerves. Now when a hiccup occurs for less than 1 hour, it's considered as benign, and usually everybody would experience that kind of hiccup on some or other day due to simple causes. But when it occurs for less than 48 hours, it's called as acute. If it is more than 48 hours, protracted or persistent or chronic, like kinds of words are used. If there is a hiccup persisting for more than a month, it is called as intractable. So these are the conventional terms used. According to the history, the record duration of the hiccup is 60 years. A person in Europe in the 19th century had a hiccup for more than 60 years till his death, and the real causes were not known at that time. The causes of the benign hiccup which everybody would experience on some other day or some other day, the most common cause is distension of the stomach. That's annaja or annaja variety mentioned by Sushruta, where the stomach is distended due to food, alcohol or air. That's those who have a habit of swallowing air, aerophagy, it can result in hiccup. Or sudden changes in the gastric temperature, like exposure to extreme cold or exposure to extreme heat also can trigger the hiccup as such. Or use of alcohol or tobacco in excess. These are the very common causes which we see. There is a significant other component, the psychogenic component. Excitement and stress also may often and produce hiccups. Psychogenic conditions like hysteria, shock, fear, personality disorders, conversion disorders, malingering also can present as a hiccup, which are due to the psychological causes. The surprise or shock is always considered to be a cause for hiccup, as well as it is now also considered as a suppression for the hiccup. Many times a person who has a persistent acute hiccup, the usual remedy, the folklore remedy would be make the patient get shocked, like make a loud sound or scold him or say that you have swallowed something. So such kind of a shock can often suppress the hiccup also. So there is a major issue is the psychological component. The causes of chronic and intractable hiccups. Now see that common benign hiccups, of course everybody would experience, and there is no need of any specific remedy. The real issue would be when the patient has a chronic or intractable hiccup which is persisting more than 48 hours or maybe a month or so. The causes could be again huge number of causes can produce the hiccup, and they can be classified as the causes that produce the diaphragmatic irritation like Hyac's hernia, subphrenic abscess, again quite common, myocardial ischemia, pericarditis also can cause the hiccup. Conditions associated with the branches of vagus nerve, irritation of the branches of vagus nerve also can produce the hiccup, like meningitis or glaucoma. The foreign bodies or hairs in the nose or maybe in the respiratory tract. Pharyngeal branches are irritated when there is pharyngitis. Recurrent laryngeal nerve is get involved with the swellings in the neck, goiter or laryngitis. The thoracic branches of the phrenic nerve could be involved in case of infections, tumors, esophagitis, myocardial infarction, asthma, trauma, thoracic aortic aneurysm or so on. And the abdominal branches could be involved in case of the tumors of the abdomen, gastric distension, rectal ulcer, abdominal aortic aneurysm, so on and so forth. And when they are even inflammatory diseases like appendicitis, cholecystitis, pancreatitis also can trigger hiccup. Now, such a condition would be always difficult to identify. the real causes to be identified requires a thorough history taking and clinical examination. Hiccup also could be produced due to CNS related conditions like the congenital malformations, malignancies in the intracranial area, sclerosis, multiple sclerosis, vascular lesions, infections like meningitis, trauma. Metabolic causes also can produce hiccup like hyponatremia, hypokalemia, hypocalcemia, hyperglycemia, uremia. Uremia quite important. Patients of renal failure often end up with the hiccup. It's considered very crucial, serious. Hypocarbia or fever. So the causes of the hiccup are quite many and they need to be identified. Causes of hiccup also could be produced due to some drugs like benzodiazepines like diazepam, barbiturates which are used as anesthetics, donepezil or dexamethasone also can produce a hiccup. Methyl dopa which is used in the treatment of Parkinson's conditions also can be a cause for the hiccup. Procedures of anesthesia related causes also are known to occur like when the neck is hyperextended during the intubation and because the phrenic nerve are stretched, diaphragm or stomach manipulation during surgery, laparotomy, thoracotomy, craniotomy also can produce hiccups. Now, so causes of hiccups are many and practically there is no definite method of differentiating these in the clinical practice. So when a patient has hiccup, the only issue is you have to take a detailed history and go for thorough examination, rule out one by one among all these causes which you have discussed and then elaborate the diagnosis. A benign hiccup doesn't require all that kind of an exercise. Only when it is chronic or intractable, you require all that interventions or the diagnostic efforts. Now, from Shushika's point of view, the differentiation of this hiccup according to the doshas and according to the causes are Mukham Kashayam Arati Gauravam Kantavakshasho Pururupani Hikkanam Atopojata. Before the hiccup occurs, patient would have a feeling of astringent taste in the mouth or discomfort, heaviness in the chest or in the neck. When the Amaja hiccup or Annaja hiccup, when the hiccup is produced due to the food, the causes could be Taramanasya Chaharam Bhunjanasya Athava Ghanam Vayu Anneha Avastirnaha Katukaihi Ardito Brisham Hikkati Urdhago Bhutva Tam Vidya Dhanajam Pishaka. A person who develops the hiccup immediately after the food and particularly if he consumes the food very rapidly, fast, without really chewing properly, or he takes more of a spicy food, in such conditions there could be hiccup produced after the food and that's the annaja due to the food, gastric distension. Chirena yamadaihi vegehi ya hikka sampravartale kambayanti shirogrivam yamalam tamir disheta. When the hiccups occurs in events of two split hiccups, like where instead of one event there could be continuous two events together, such a hiccup is called as a yamala, and in this condition the patient would have more rigorous movement of the head and the neck. This could be often, though not exactly, can be often seen due to the central pathologies like meningitis, meningeal tumors, or intracranial tumors, etc. The hiccup would present with that kind of an appearance where the person would have more severe contraction of the neck muscles. Then Vikrista Kadehi Begihi Mandehi Samabhivartate Kshudrika Namasa Hikka Jatu Mulat Pradhavita. A low intensity hiccup which can present at any time of the day, that's called as a Kshudrika, and it's often produced from the neck area. Now, a shallow hiccup or low effort hiccups are commonly seen in case of uremia conditions. Patients with uremia, chronic uremia, often would have a low intensity hiccup. So, maybe that Kshudrika could be related to the same. Nabi Pravrtaya Hikka Ghora Gambhiranadini Shushka Osta Kanta Jihva Asya Shwasa Parsharujakari Aneka Pudru Yukta Gambhira Namsasura. Gambhira Hikka is when it is produced with the severe contraction of the abdominal muscles and the sound is more, and the patient would have a dryness in the mouth or oral cavity, and even the tongue will be dry. Even patient may have a pain in the abdomen. That is considered as the Gambhira Hikka, often seen in intra-abdominal infective pathology like cholecystitis, pancreatitis, appendicitis, etc. मर्माणि आपीडयन् अन्तीव सत्सम्या प्रवर्तते देहम् आयम्य वेगेन घोषयति अतिदृश्यतः महाहिक्केति साज्ञया सर्वगात्रप्रकम्बिनी महाहिक्का where the whole body tends to get contracted and the patient would have a very serious clinical condition, the general condition also would be affected, and the patient may even have the body being bent. This kind of hikka is called as mahahikka. Of course, any patient would have that kind of phenomena, but most of the times the patient who have a central nervous system pathology like a cerebrovascular accident, and then the patient develops a hiccup, these could be the clinical presentations. आयम्यते हिक्कातो अंगानि यस्य दृष्टिश्च ऊर्ध्वं ताम्यते यस्य गाढं क्षीणो अन्नद्विट कासते यश्च हिक्की तो द्वावन्त्यौ वर्धयेत् हिक्कमानो. A hiccup patient presenting with a contraction of the body or curvature of the body, and where these eyes would be, the vision would be looking upwards, like the eyeball would be having a restricted movement, and the patient also would have a impairment of the general condition of the body. The patient is very weak and is not able to take food, and there will be even cough also accompanying. Such conditions are considered asadhya, as well as gambhira and mahahikka also are considered as asadhya. Now, the treatment protocols can be yasyahumma makshitena avapide pippandrova sharkara churnayuktaha sarpik koshnam kshiram mikshorasova natiksheenam chhardanam shantihetoho. A person with the moderate hiccup can be treated with madhyasti, makshika, acid or hippadi, sharkara churna and ghee, which are mixed together with the kshira and ikshurasa, the sugar cane juice, and vamana followed by. These could be the protocol of the treatment of hikka. Naripayaha pishtam ashukla chandranam घृतं सुकोष्णं च ससैन्धवं तथा चूर्णीकृतं सैन्धवं अम्भसा अथवा निहन्ति हिक्कां च हितं च नश्यतः. A Nastya yoga where breast milk along with the Krishna Chandana and Ghripa and Saindhava are added, and the Nastya is given with this. Yunjat dhumam shala niryasajatam naipalam va go vishanudbhavam va sarpi snigdehi charmapalehi kritam va hikkasthane swedanam chapi karyam. Or dhumapana with the shala niryasa and go vishana, that's the horns of the cows also are used for the dhuma. Or the Svedana at the Hikkasthana, at the location where the Hikka is felt, like in the abdomen. Kshaudropetam gairikam kanjanaham likhyat bhasma gramya sattva asthijam japa tadvat shavin mesha goshaljakaram romani antaha dhuma dagthani chatra madhu adhyaktam barhi patra prasutam evam bhasma audambaram tailvagam va Sardiksharam Bijapuradrasena Kshaudropetam Hanti Lidha Ashuhikam. Another of the yoga where Gairika, Kanchana, etc. are used for the Hikka. Sarpisnita Ghanti Hikkam Yavag Baha Koshnakdasa Payasova Sukoshnaha. The Yavagu with the ghee and eaten well can also reduce Hikka, which should be taken with the warm food or in the form of a payasa. Shunki toye sadhitam kshiram adam tadut pitam sharkara sayudam va atrupterva sevimanam nihanyata ghratam hikkam ashumutram tujat ajabhyuho. Shunti kashaya with the kshira and ajakshira, the goat's milk, and sharkara, sugar, it can be given internally, or the urine of sheep and goat also can be used as a treatment. Saputikitam lashana ugragandha hingvabdam achurnya subhavitam tata kshaudram sitam varanam kesharam ja pibet rasena ikshu madhukajena. Another of the yoga for the hikka. Pibet palam lavanoktamasya dvabhyam palabhyam havishat samadram. Saindhava lavana is also suggested. Haritikam koshna jalanapanam pibet gritam kshyara madhu upapanna rasam kapittat madhu vipadibhyam shukti pramanam prabhivet sukhaya. Haritaki with the ushna jala with the ghrita also can be given. Krishnam sitam cha amalakam cha leadham Sringaveram madhuna athapapi kolasti majja anjana lala churnam hikka nihanti madhuna avalidham. Another amalaka with the sugar candy, black in color, black sugar candy, and or Shungavera Shunti or Madhu also can be given. पाटलायाः फलं पुष्पं गैरिकं कटरोहिणी खर्जूरमद्यं मागभ्यः काशीशं दधिनाम च चत्वार एते योगाः स्युः प्रतिपादप्रदर्शिताः मधुद्वितीयाः कर्तव्याः ते हिक्कासु जानत. Another of the yoga where patala pushpa with gairika or katarohini as such or kharjura or with the shunti, kashisha and the dathi. These are the different yogas, individual yogas which could be used. Kapota paravata lava shaka shwadamsha bodha vrishadamsha janatasan pibet फलाम्लान् अहिमान् ससैन्धवान् सिग्धां सदैव वर्ष तथैव वर्षी मृगद्विज उद्भवान् विरेचनं पथ्यतमं ससैन्धवं घृतं सुकोष्ठं च स्थितोपलायुतं सदागतौ ऊर्ध्वगते अनुवासनं वदन्ति च केचित् च हिताय हिक्कीनां. Virechana yoga with the mamsarasa of the soup of birds like kapota paravata etc. Or phalamla also can be given as virechana, or any anuloma treatment is suggested. Now as far as the current approach to the treatment for the hiccup is concerned, because there are lots of options there, one of the famous statements related to the hiccup treatment is by Mayo Clinic, famous statement of Mayo Clinic, I quoted as it: the amount of knowledge on any subject such as this in the sense in the context of the treatment of hiccup can be considered as being in inverse proportion to the number of different treatments suggested and tried for it. The meaning is, as we do not know much about the hiccup, the real causes of the hiccup and the real treatment for the hiccup is not known, we have too many options, and it is quite true that whenever you do not know the exact answer, you have too many answers there. And the certain of the acceptable standard remedies suggested for the treatment of hiccup in the contemporary system is with the non-pharmacological therapy, stimulation of the nasopharynx by applying forcible traction on the tongue, pull the tongue up, or swallowing sugar, that's the sugar candy, gargling with water, sipping ice water, drinking from the far side of a glass, that's keeping the height and then drinking from height, biting a lemon, inhaling noxious agents like ammonia. These are all the different ways by which the nasopharynx could be stimulated. Now I am quoting these from the standard protocols of the treatment which are approved by FDA. And to stimulate the C3-C5 dermatome by tapping or rubbing the back of the neck, spraying coolants or acupuncture. Then direct pharyngeal stimulation by a nasal or oral catheter, which is considered to be 90% effective. Uvular stimulation by a spoon or cotton tip applicator. Removal of the gastric contents by means of emetics or nasogastric tube. That's about the local stimulation. Then vagal stimulation could be triggered by iced gastric lavage, valsalus manoris, holding the breath with the compression of the abdomen. Carotid sinus massage over the carotid sinus. Digital ocular globe pressure, putting the pressure upon the eyes, superior surface. Digital rectal massage, putting the finger into the rectum also can be a remedy for the hiccups in certain conditions. And the mechanism by which the normal respiratory function can be broken or interfered would be breath holding, hyperventilation where you ask the patient to breathe rapidly, gasping as in fright, like when hold the breath and then take a deep breath, breathing into a paper bag which increases the carbon dioxide level, pulling the knees up to the chest and leaning forward, which increases the compression of the chest, then continuous positive airway pressure, maybe CPAP like, or rebreathing with carbon dioxide. The mental distraction, the other very common thing which is done in the regular practice is a mental distraction, behavioral condition like including maybe scolding or so on. Hypnosis, acupuncture is now considered as very standard. Chronic nerve or diaphragmatic pacing, like which is more stimulation of these nerves directly. The prayer also is considered as a remedy. As per the records, there were many patients who were tried with the double control study, double brain control study, where prayer was suggested, and it was considered the prayer has a significant benefit over the medicines which are used there. Surgical intervention like clinic nerve ablation also can be done. The drugs which are often used in the treatment of different hiccups are muscle relaxants, sedatives, analgesics, or groups like dexamethasone, amantadine, or edophonium also often used as a remedy for treatment, but none of them are really the standard prescriptions based upon the evidence-based approach. With this, we conclude this chapter. श्रीसुश्रुतसंहितायाम् उत्तरतन्त्रान्तर्गते कायचिकित्सातन्त्रे हिक्का प्रतिषेधो नाम द्वादशोऽध्यायः आदितः 50तमोऽध्यायः. If there are any questions, we will try to answer and then wind up. Right? There are no questions, so we will wind up. We will continue in the next session.